Hi everyone, thanks for joining. We're going to get started now. Today we have Dr. Moore here, so I'll turn it over to him for some brief remarks.
Good afternoon, bon après-midi à tous. On Monday, Ontario started the gradual reopening, and I want to thank Ontarians for the sacrifices they have made that allowed us to get to this point. Because of your efforts to help blunt the transmission of Omicron, our healthcare indicators suggest a general improvement in the COVID-19 situation in the province. Thank you. Lundi dernier, la réouverture de l'Ontario a commencé graduellement et je remercie la population ontarienne de tous leurs sacrifices qui nous ont permis d'arriver à ce stade. Grâce à vos efforts pour atténuer la transmission de Omicron, nos indicateurs des soins de santé signalent une amélioration générale de la situation de la COVID-19 dans la province. However, we recognize that some areas of the province still have precarious and strained healthcare capacity, and we still need to come together as a province to support all regions as we move ahead in our reopening. While the coming weeks will continue to be difficult for our hospital system, the number of hospitalizations is currently stable, and given current trends, we are more confident in our ability to ensure capacity across the province so that all Ontarians can get care at the right time and at the right place. ICU numbers remain high, but the number of COVID-19 patients are now starting to decrease, and we have increased capacity to provide care to those who need it. The percent positivity of tests continues to decrease, with our average this past week declining to 14.64% from 18.4% the week prior. Based on the current stabilization in Ontario's testing strategy, this is likely reflective of a real decline. Long-term care outbreaks are also declining, and we recently saw the first decline in the number of active resident cases in long-term care since the Omicron variant became the dominant strain. There has also been an increase of wastewater sites across the province reporting a downward trend in COVID-19 detections. These trends are encouraging, but we must remain vigilant and adhere to the measures that are helping reduce transmission, such as staying home when you're sick, wearing a well-fitted mask, distancing, and getting vaccinated and boosted. These individual actions will lead to our collective protection. I also want to take this opportunity to acknowledge our educators, parents, and students for their dedication to making the return to in-person learning as successful and as safe as possible. J'aimerais aussi saisir l'occasion de reconnaître le dévouement de nos éducateurs, des parents et des élèves à rendre le retour à l'apprentissage en personne aussi réussi et sûr que possible. In the last week, approximately 13.3% of students and staff were absent each day, and over 94% of schools have reported less than 30% of students and staff absent. We also saw less than 1% of schools were closed each day, so only 7 out of 4,844 schools. And these closures are typically due to operational challenges such as staff shortages. Keeping our children and youth in school is critical to their mental health and well-being, and I thank you for all the support you're doing for our children's academic success. In addition to all the measures in place at schools to help them remain as safe as possible, vaccination is also a key. And the vaccines we have are safe and effective and the best way to protect our children from COVID-19. To date, 87.1% of Ontarians aged 12 to 17 have received one dose of a COVID-19 vaccine, and 83.6% are fully vaccinated. And we continue to make progress in our vaccination campaign for our 5 to 11-year-olds. 53.9% have received one dose, and 20.2% are fully immunized. We increased that by 10% in January alone. So thank you to the parents. As we seek to improve our immunization rates in our youngest eligible age group, it is our goal to ensure that parents of children feel well informed and safe when deciding to have their children immunized. The Children's Health Coalition, in collaboration with the Hospital for Sick Children, has launched a children's vaccine confidence campaign to provide parents and caregivers with information to make an informed decision. Parents, caregivers, and children are also encouraged to call the Provincial Vaccine Confidence Line or book a confidential phone appointment with Sick Kids clinician through their COVID-19 vaccine consultation service. I know that for parents, nothing is more important than the health and well-being of their children, and having credible sources of information they can rely on to be scientific and factually correct is important. The resources are there to help you answer all the questions you may have, as are your trusted healthcare professionals. Je sais que pour les parents, il n'y a rien plus important que la santé et bien-être de leurs enfants. Il est donc extrêmement important de pouvoir compter sur des sources d'informations crédibles fondées sur la science et les faits. Les ressources sont à votre disposition pour aider à répondre à toutes vos questions, tout comme le sont vos professionnels des soins de santé de confiance. Though vaccination remains key, we do have antivirals available to help us manage the impact of this virus. Because of the limited supply of Paxlovid, which is an outpatient oral treatment, we are prioritizing the distribution to unvaccinated individuals who are at risk of severe outcomes of COVID-19 infection, including hospitalization. This includes unvaccinated seniors aged 60 and over, First Nations, Inuit, and Métis individuals aged 50 and over, and individuals aged 50 and over with underlying risk factors. We are also prioritizing immunocompromised individuals 18 and over, regardless of their vaccine status. As of today, 12 treatment courses of Paxlovid have been distributed through the 15 sites. Though it is no substitute for immunization, Paxlovid is available and will significantly reduce the risk of hospitalization if taken within 5 days of symptom onset. And in the randomized controlled trials, they reduce the risk by 88%. If you think you may be eligible to receive Paxlovid, you can contact your primary care provider, call Telehealth Ontario, or visit a COVID-19 clinical assessment center. Si vous pensez être admissible au traitement par Paxlovid, vous pouvez communiquer avec votre fournisseur de soins primaires, appelez Télésanté Ontario, vous rendre dans un centre d'évaluation clinique de la COVID-19. I also wanted to mention an update on our PCR testing eligibility. We continue to prioritize PCR testing for those at the highest risk of severe outcomes, including those eligible for COVID-19 treatments, such as antivirals, those who work and live in the highest risk settings, and patient-facing healthcare workers. We are expanding eligibility to now include household members of patient-facing healthcare workers in order to support timely identification of cases in healthcare workers and ongoing delivery of healthcare services. I want to thank Ontarians for the sacrifices they have made and for their continued cooperation when it comes to following the public health measures that we know work. Your actions are having an impact. The trends are looking positive, but we must remain cautious, and our continued reopening efforts must be implemented cautiously. Thank you. Merci.
We'll go to the phone lines for questions. Just a reminder, it's one question, one follow-up. Over to the first question, please.
From Alison Jones at the Canadian Press.
Hi, Dr. Moore. Given the significant number of people who were infected with Omicron over the past 2 months, I think a lot of people are curious about what sort of immunity that confers. If you were fully vaccinated and got Omicron, or even boosted and got Omicron, can you sort of throw caution to the wind, assume you've got super immunity, or are people who had Omicron susceptible to being reinfected with Omicron? I think there's some preliminary research out there, but is Ontario tracking this?
So, a really good question. It appears with Omicron, if you get natural immunity, so you're not vaccinated and you get infected by Omicron, you do have some immunity against further reinfection, but there is significantly a risk for reinfection from Omicron over time. So we're not confident in how long that duration of immunity is from natural exposure yet. It's still early days. We have heard from our immunologist partners that if you have had natural infection and you get an mRNA booster vaccine, that significantly adds to your level of protection and length of protection against Omicron. So it has been the recommendation from the National Advisory Committee to get immunized with an mRNA vaccine, even if you've had natural exposure, given that it provides longer and stronger and more beneficial protection against any risk for reinfection. So you may, in layman's terms, consider getting infected naturally by Omicron as almost equal to one dose of vaccine, and subsequent benefit is maintained by having a follow-up vaccine, obviously after complete resolution of symptoms, and it's best to actually have a roughly 8-week minimum time delay from your first exposure that will give you much longer lasting and acting protection. So pretty complex question, but thanks for asking it.
Yes, on a slightly different topic. You and some other health officials and government officials have started talking recently about learning to live with COVID. And I'm wondering if you could give us a fuller picture of what that looks like. Does it mean just returning to our 2019 way of life, or does it mean something else?
Yeah, I think we really have to approach the reality that Omicron is highly infectious and is going to be difficult to control and limit. And now that we have safe and effective vaccines, as well as safe and effective outpatient treatments and inpatient treatments, it comes to a time where we're going to have to decide how many public health measures we'll maintain going forward and how we can try to maintain our mental, physical, social, economic, and educational well-being in the face of an ongoing threat from this strain of viruses. I think it's a discussion we have to have at a societal level of what our values are. But with these tools that we now have in place, I think the discussion has to occur. And we have to decide as a society how many public health measures we want to just recommend and or maintain in a legal fashion to limit the spread of the viruses. I think that discussion should happen soon, given that some of our trending is heading in the right direction. We're following other countries such as the UK, South Africa, that are also on downward trends from Omicron and yet don't have the same level of public health measures in place. So it'll be a societal discussion and government will make the eventual decisions, but I think it's worthwhile as a society to start having those discussions.
Next question.
From Randall Denley at the National Post.
Hello, Dr. Moore. Looking at the vaccine dashboard, and I know that the case levels between comparing the vaccinated and unvaccinated are quite similar to each other. I'm also seeing some international studies saying that there's similar rates of transmission between the two groups. I wonder what your thoughts are now. Do the unvaccinated still pose a greater threat of transmission than the vaccinated in Ontario?
So, really complex question. The 2 doses of vaccine with Omicron don't seem to limit the risk of transmission significantly. And though 3 doses can give you a much better protection against the risk of transmission. So up to 60% benefit on decreasing your risk of transmission. So the problem is now that this vaccine that we have against Omicron doesn't cause sterile immunity, doesn't limit the risk of an immunized person carrying the virus significantly with 2 doses. 3 doses certainly does. I should say, though, the major caveat and protection of the vaccine is that it limits the severe outcomes. And recent studies that are going to get published from Ontario data show up to 95% protection of 3 doses against severe outcomes associated with this virus. So, very good point. The vaccine isn't providing significant benefit at 2 doses against the risk of transmission as compared to someone unvaccinated, but it provides excellent benefit, and what I think most people want is to avoid hospitalization and ending up in the intensive care unit or frankly dying from this virus. The vaccine protects significantly against those severe outcomes. So when we see a vaccine that doesn't provide the sterile immunity like it did provide against Delta, we have to reassess some of the public health measures that we've put in place, reassess whether we maintain a proof of vaccination certification process, given the decreased benefit against transmission. But reiterating, 3 doses does provide a significant benefit.
Follow-up?
You've anticipated my second question. I was going to ask you whether that the difference between the two is enough now to justify a passport system, although we have one in place apparently till March the 15th. But let me rephrase it because I think you said for 2 doses, no, if I hear you correctly. But is your sense that we should keep passports and go with 3 doses or get rid of passports?
I think we have to reassess the value of the passports in the coming weeks and months. And clearly, again, that's a government decision. The main benefit of the passport system now is that against severe outcomes, we are well protected with 2 doses, and hence increased socialization of someone unvaccinated and increase in their risk of getting Omicron through accessing any of these venues does increase their personal risk. So it does protect the unvaccinated person well against transmission and against severe outcomes by not being able to access mass gatherings and or many of these venues. But my preference would be that we only have 6.7 million Ontarians that taken advantage of the 3rd dose, is that more Ontarians, especially if you've got any chronic underlying illness and or by age alone, 50 and up, I would really suggest you get that 3rd dose if you haven't already. It is proving to be so beneficial against the risk of transmission, but also against severe outcomes. So we just have to be honest about the benefits now of 2 doses of the vaccine and review the implications for all of our public health measures that we've put in place. And I think those discussions will be happening in the coming weeks and months, as you've raised, Russell.
Next question.
From Matthew Bingley at the Global News.
Hi, Doctor. I'd just like to follow up on Allison's question. You said that some of those decisions would have to be made at a societal level of what measures might need to be considered going forward. I'm wondering what options you would actually suggest in your capacity as public health measures that would be necessary to keep around for a while.
So the general recommendations on distancing and hand hygiene, I think, are prudent and reasonable, but clearly the most important one, and probably the last one to go, will be masking. Given that masking protects me, it protects you, but it protects the most vulnerable members of our community from transmission. And I think that will be probably the last of the public health measures to go. We just had a brief discussion about the proof of vaccination. 3 doses is so much superior to 2 doses against risk of transmission and severe outcomes that I hope more Ontarians embrace it. But we're waiting federal guidance on whether their proof of vaccination for international travel will move to 3 vaccines, etc. But in the interim of all the measures, I think the masking will be the last to go. We'll certainly have to review the proof of vaccination. I think it's common sense on hand hygiene and distancing. And I would hope, even if we don't mandate masking, that anyone that's vulnerable to this virus will continue to mask and that it become a community standard, especially as we return into the fall, where we anticipate all the respiratory viruses will try to come back and spread amongst us.
Follow-up?
Thank you. And on BA2, with the number of cases that have been seen to take over in Denmark, with our reopening, I'm wondering how many cases you're currently tracking in the province, and what concerns you have as more people begin to go out and it has the opportunity to spread more here.
Well, great question. It's still early days with BA2. We've had 29 cases of BA2 detected in Ontario through our robust whole genome sequencing strategy. Those were reported to us yesterday. Clinically, we're not seeing any different outcomes. It's very small numbers between BA2 and others in terms of the hospitalization rate of those 29 cases or severe outcomes. It's something I think internationally we're going to need large numbers to be able to ascertain if there's an increase in virulence. We do anticipate that there's an increase in transmissibility of BA2. We will be monitoring about vaccine effectiveness against it, but there's nothing from our immunologists or Public Health Ontario scientists that have told us that they're concerned about vaccine escape with this strain. And given that we have good cellular immunity against Omicron, we anticipate having the same against the BA2 strain of it. So it's early days. We're monitoring the situation very closely. That 29 cases is an underrepresentation, given that it's the whole genome sequencing of the level of activity in our community, and we'll be monitoring it very closely going forward.
Next question.
From Stella Dupuis, Radio-Canada.
Hello, Dr. Moore. So I have a question for you. You said that we have to start learning to live with COVID, and I was wondering, what does that look like? Because we've lived with wearing masks, staying home for extended period of time with a runny nose, standing 6 feet apart. When does that end? Because that's not how we live with other viruses.
Yeah, it'll be a journey for us. Stella, that's a great question. We've had 2 years where we've been very fearful of this virus, and the strains have changed over time. We're fortunate that with Omicron, it has less severe outcomes than the previous strains, and we're fortunate that we have safe and effective vaccines that prevent severe outcomes, and now we have good oral outpatient antiviral therapies. So as a society, to decrease that fear will take time for us to normalize living with this virus. I think some of the basic tenets that we've learned over the last 2 years we will maintain, especially going into the fall, of hand hygiene and distancing. Many of us will continue to wear masks even if they're not mandated at that time. And I do believe that over time we won't have proof of immunization necessary to get into certain venues. Clearly, the federal government has responsibilities for international travel and whether that will be maintained. But all of that has to get reviewed. I would think the same tenets that if you do have symptoms of a virus, no matter what virus, a fever, a cough, a runny nose, and certainly there's hundreds of different viruses that can cause those symptoms, that you would stay home if you're ill, that you'd come back to work once your symptoms have recovered, and that once at work you'd still practice good hand hygiene, monitoring your symptoms, etc. So it'll be a journey as a society to come out of this and to normalize Omicron and COVID as we've normalized all the other viruses. And I do think we'll also have the addition of an annual vaccine for the next several years just to maintain immune protection against any surges of hospitalization. And I'm looking forward to hearing from the immunization companies whether that'll get integrated with an influenza vaccine, which would certainly make it easier from a patient vantage point.
Follow-up?
Yes, Dr. Moore, I was wondering, do you consider that the worst of the pandemic is behind us?
I've been humbled by this virus too many times. We're in wave 5 now, and alpha, beta, gamma, delta. and now Omicron. We know this virus wants to mutate, roughly 2 significant mutations every month, and any one of them can emerge and become a dominant strain. So I'm hopeful. I'm very hopeful about the impact of the vaccine campaign as well as the oral outpatient antiviral therapies we now have available to us, that we can get back to a more normal lifestyle, but we'll have to be very cautious. We are monitoring the situation internationally with our federal partners, looking and adhering to our surveillance obligations to detect any new strains within Ontario, and sharing that federally and then internationally. And likewise, I'm confident all countries around the globe are trying to identify if there's new strains developing and taking appropriate public health action. So we're not out of the woods yet. We still have to be cautious. But we've learned significantly from the last 2 years, and I do believe we're in a much better position to learn to live with this virus and to be less fearful of it.
Last question.
From John McGrath at TVO.
Good afternoon, Doctor. In terms of the testing, I note that you've expanded the eligibility for PCR testing today, but, you know, the science table, for example, says that, you know, it's very challenging to do modeling right now because the testing is so limited. We don't have an estimate of what the province-wide R number is. You know, the lack of testing really is hampering some of what we can say we know about what is going on in the province right now. And so I'm curious why we aren't talking about a more aggressive approach to expanding testing again, if for no other reason than to get a better idea of what's going on.
Well, thanks, John. So the PCR testing capacity in Ontario is a finite resource, and we have to use it judiciously. We've also complemented the PCR capacity with a very robust rapid antigen testing capacity, and hopefully the supply will improve from the federal government, where we can have it even more widely available. 3.9 million RATs distributed to students across our elementary and secondary schools. That will be expanded and replenished over time. We continue to have rapid antigen testing availability to our long-term care partners, acute care partners as well, for screening for workers and education workers as well. So we're using multiple different testing modalities that are complementary, but I have to acknowledge the PCR testing is a finite capacity that we have to use judiciously, and we're just now getting our turnaround time for within 48 hours to an acceptable 80% level, where we can action them, because we need to use PCR tests in the high-risk congregate settings, hospital settings, to help us document who should and can receive therapies, because they're dependent upon a PCR test being positive. So bear with us. We're reviewing the capacity on a regular basis. The testing expert panel gives us advice on how we can judiciously, slowly expand the use of the PCR capacity that we built in Ontario. And I think we should acknowledge we've got good data coming from our hospitals now on the total number of people hospitalized, which is on the decline, total number of people in the intensive care unit, which is again on the decline, and the wastewater surveillance system that is in across Ontario is showing also a decline. So we have multiple surveillance and data points that are helping us, give us situational awareness, and from my vantage point, monitoring all of these, we're trending in the right direction. We know reopening the economy could lead to some rough times in February, as we have increased socialization and increased risk to transmission, but we'll monitor that, and we've built good hospital capacity for February. So I think January was tough. February will be better. I do see things improving further in March, and then hopefully a low endemic rate in April. All the meanwhile, I hope Ontarians come forward and continue to take advantage of our robust immunization strategy, continue to take advantage of the third doses, which are so protective against severe outcomes. I'd love more Ontarians to come forward for that third dose 84 days after your last, to get the best protection we can from these safe and effective vaccines.
Follow up, and this is the last question.
There were, I guess, problems with relying too much on the daily case count, but it was the most leading indicator that we had in terms of warning us when a spike in hospitalizations was coming. So, do you see things like the wastewater surveillance as a substitute for that, as a sort of an early warning system, or are we going to have to expand PCR testing in a way that if we don't have wide open eligibility, is there a way to expand it in a way that restores a bit more of maybe a statistical sample, if you know what I mean?
That's a really good point. To be clear, with 30,000 PCR tests done on average last week, the percent positivity is on the decline. So to me, that's a good signal. It's reliable now that it's a stable population that's getting tested. I think the wastewater surveillance at a population level gives us a good indication as well, since so many communities are seeing a decline in the positivity. And then we're what we traditionally do for respiratory viruses is we have sentinel primary care providers or sentinel partners that tests every third or fifth patient that show up with a respiratory complaint of a virus-like nature. And we sample them for multiple different viruses to get awareness of what's the predominant virus. So outside of COVID right now, it's respiratory syncytial virus is the significant strain that's spreading across Ontario. We need to have a robust sentinel surveillance network that will also provide us with input on what are the circulating viruses, and we're working on having that up and running for this fall, so we can inform people of what's the dominant virus, so that they're aware and they can take appropriate precautions. Some spread more rapidly through touching surfaces, some are more airborne, and some are a mix, and we'll be able to communicate that risk as schools reopen in the fall, and we move indoors in the winter of 2022-23.
Thanks, everyone.